We have a policy on masking for everybody that includes patients, visitors, and all staff. And that policy is based on safety for our patients and the staff that takes care of the patient. The reason why that's important is because we're in the middle of a pandemic with coronavirus, as most people know, and sometimes these infections are very severe and can be deadly, in particular in an area where patients have immune deficiencies and are unwell. We are following that policy, which is basically taking a surgical mask like this one and covering it over fairly tightly over the nose and the whole mouth area down to the chin, by the way. So we're following that policy from national guidelines and also state policy. The governor has stated that people have to wear a face covering for safety reasons. So one of the questions we get a lot is what kind of mask is appropriate. And hard to believe, but people actually do research on this kind of thing, in the sense that different face coverings have been really examined in terms of how effective are they in preventing the kind of problems that we really don't want to have in a cancer office. And turns out that surgical masks are actually much more effective than other types of face covering, including textiles and scars and things that you see if you say go to a supermarket or something like that. And so what we will ask patients when they come in is to actually use a real surgical mask like the one I'm wearing right now in order to achieve a higher degree of safety. We will provide these masks for patients that do not have one. I understand that probably most people don't just have a bunch of surgical masks lying around in their house, although some people do. And so everybody who comes to the office will get a mask for free, obviously, and we will ask patients to put that mask on. So occasionally we have patients that come in with a cloth mask and don't want to take the mask off or don't feel comfortable doing that. It's perfectly acceptable and not a problem to put the surgical mask over the cloth mask. Maybe they even get better protection that way, we don't know that, but certainly we want to have everybody who comes to our office to have a surgical mask on. Whether they wear a separate mask under that or not is a different story, but everybody needs to have one of these, please. We get a lot of questions about why masking and why certain types of masks. And the reason is that we know from research that masks can prevent transmission of coronavirus. And the way this works is that the virus actually doesn't just float through the air, it typically attaches itself to something. And that something typically is a droplet. So when patients have the virus in them and they speak and some droplets come out of their mouth or their nose, at that point in time they can contain viral particles. So the virus itself is very, very small, but the droplets are not that small and they can be effectively caught by wearing a mask. So the research has shown that the transmission is very, very low, meaning the rate of infection is very low if both parties, i.e. the staff member and the patient, both wear a surgical mask, which is why we are having this policy in the first place. But the important point here is that when patients are interacting with one of our staff, that person will have a surgical mask on. In addition, we have started to encourage the use of face shields in certain situations. A face shield is a plastic cover that covers the whole face, and in situations where there might be higher risk for one reason or another, you will see staff members also that wear a face shield in addition to the surgical mask. Well, the real purpose of doing all of this is to keep everybody safe. And obviously we have patients that are at higher risk than average. So we have an obligation to the patients to keep them safe and keep the staff safe. On the contrary, we are trying to really impress on people that we don't want to impose this on anyone for no good reason. So please help us keep everybody safe.